My name is Erica Clinton, and I will serve as the moderator for our dialogue today with Beth Violet, who is a registered dietitian nutritionist and a board certified specialist in oncology nutrition. Beth currently works at Dartmouth Cancer Center in Manchester, New Hampshire. She received her board certification in oncology nutrition in 2021 after studying nutrition at the University of Massachusetts Amherst, where she graduated in 1990. Beth has an additional certification as certified diabetes care and education specialist and certified nutrition support clinician. She is currently preparing to become a national board certified health and wellness coach through Well Coaches. She finds healing and inspiration in nature hiking, biking, and paddleboarding, and volunteering at an educational farm. Thank you so much, Beth, for taking the time to join us today. How are you?
Good. Thank you, Erica, for the invitation. I greatly appreciate collaboration, and I love the work that oncology massage therapists do.
Wonderful. Well, I hope we're going to get to spend some time kind of talking about what you do and talking about the places where our worlds best connect and how we can collaborate to best serve, the clients and patients that we both find so wonderful to work with.
Yes.
So to start, I'd love to help our practitioners understand your work. So can you explain to us what an oncology dietitian nutritionist does?
Yes. So nutrition is an important and essential part of cancer treatment and recovery. So as an oncology dietitian nutritionist, I help patients with medical nutrition therapy, which is evidence-based advice to help them manage the side effects of treatment. And that can include nausea and vomiting, constipation and diarrhea, trouble swallowing, weight loss, a poor appetite, taste changes, fatigue. There's a whole array of symptoms that can impact someone during cancer treatment that affects what they can eat and how much they can eat. So my job is to provide them resources and help them to maintain their strength and their nutrition.
Which is obviously so critical during cancer treatment.
Yes.
So you're a board certified oncology dietitian nutritionist. I'm learning a lot just from that title. Is board certification a requirement to work in oncology?
Well, the first thing that is required is to be a registered dietitian, which involves having a bachelor's degree and 1,000 hours of supervised practice, plus taking an exam. Since 2024, that requires a master's degree. The oncology certification on top of that takes an additional 2,000 hours of work in oncology and taking a board certified examination, and the core curriculum of that is about 700 pages. So there's about 100 oncology dietitians in the United States out of 112,000 dietitians altogether. So about 1% of all dietitians have this additional certification in oncology.
Okay, so 900 board certified
Oncology.
in 50 states.
Yes.
With almost 400 million people in this country.
So there's 4 of us in New Hampshire.
Wow. That's just startling on some level when we think about how many people are diagnosed with cancer every day, every year, and all the support that they have from oncologists and nurse navigators and different practitioners. And with what I would assume that nutrition is a huge component to help maintain their health status, that there's so few of you in the entire country.
Well, most cancer centers do have a dietitian working with them. And so a dietitian without the additional certification does have the basic foundation to assist patients. There is definitely a need to expand access to dietitians in oncology centers. There is a gap. There are some patients never see a dietitian throughout their treatment. And nutrition, that should be an essential part of their treatment and their recovery and survivorship, using nutrition to stay healthy and fight cancer and decrease their risk of recurrence. So,
Yeah.
yeah.
I mean, in terms of like the long-term goals,
Yes.
Nutrition, I would be like, oh, I would bump that up the chain a few places for all of us, but particularly someone who has gone through cancer treatment. So it's just it's really interesting when you think
Yeah.
about those numbers and those statistics. But what are some common misconceptions about nutritionists? I'm sure there are a lot. I'm sure
Yes,
there are.
I so appreciate that question. So the top ones that I think of are that I'm the diet police, that my only avenue is restriction, that the only thing I do is promote weight loss, that I want people to give up their favorite foods, that there's a lot of judgment. So those I would say are the top ones that I think people perceive. And I'm always trying to correct that and help people to understand that I want people to have strong bodies. I want them to nourish their bodies. I want them to love their bodies and have a good relationship with food and feel nourished by it.
So interesting that you say that because, of course, in my mind, I'm thinking, oh, a nutritionist. This is a person that I can ask all these questions about food that I've ever wanted to know, and they're going to tell it to me straight, right? I mean, I remember reading something that just startled me, and I bring it back because I find it to be like one of the most ridiculous concepts. But I remember reading something that said when the FDA had allowed companies to advertise that food was light, that it could just be light in color. And I thought, oh, dear goodness. Okay, we have no idea about nutritional value and what is low in calorie or more healthy or how to deal with certain things. So to me, you feel like the information highway about food. And so I think it's so interesting, though, the misconceptions that people would think that your job or part of what you would do would be to judge them and their relationship with food. But I guess that relationship is deeper than a lot of us ever understand, maybe about ourselves.
Yes. A lot of the patients I work with are over 50, and some women have struggled with their weight and their relationship with food their whole life. And so they have negative connotations. I think the term dietitian, they think diet culture and the restriction and all the negative things. So I do a lot of talking on, I'm here to help you and support you during treatment so that you can keep your body nourished, so that it can work for you at its full capacity. So it is a common thing for me.
Wow, that's so. And I guess I would say, in terms of like recommending a consultation to an oncology client, that maybe the nutritionist is there to help you deal with cravings or how to gratify that part of you that wants a certain taste or quality of food, but in the best way.
Yes. Yes. I would call it maximizing their nutrition during treatment, encouraging nutrient-dense foods, but still including foods that they enjoy. I don't consider any food to be a bad food, but just really taking them where they're at and working with them with their own internal motivation and their self-autonomy for where they're at and where they want to go to improve.
Okay, that makes sense. So, why is nutrition so important for cancer patients? And is it more important like during treatment, before treatment starts, after all of those?
Nutrition is important in all the places, at diagnosis, before diagnosis, after diagnosis. Nutrition needs and issues look differently than someone who's completed treatment versus someone in treatment. But adequate nutrition and keeping someone strong can help them prevent treatment breaks. It can help them preserve their lean body mass. It can help decrease the symptoms of treatment or the side effects of treatment. Adequate hydration, adequate protein, adequate calories, nutrient density. It just helps people feel better during treatment. And then it can also influence prognosis if a patient is able to maintain good nutrition without severe unintended weight loss during treatment.
That's really an important key factor, right? Is that maintaining that body mass during treatment hopefully means that a lot of things are, I guess, better, even blood counts, energy levels, the ability to maintain their appointments, all of
Yes.
which
Yeah.
can slow down treatment.
Mm-hmm. And definitely helps the immune system. It helps them to fight infection. It helps them to prevent hospitalization. So it's really an integral part of the treatment. Adequate nutrition is part of cancer treatment.
Amazing. So post-treatment, right? So people, as they, I guess, look at their nutrition on a, on a spectrum of kind of, this is what I needed during treatment. Post-treatment, is there the ability to kind of go back to what you were doing before? Are there things that people should avoid or try and, eat more organically if that's available to them?
Think working with patients post-treatment, there is definitely a need for that is not met.
Mhm.
Just earlier this week, I was speaking at our local breast care center with breast cancer survivors. So all of them, this particular group, all of them had finished treatment. And I was talking about what can you do to decrease your risk for recurrence. There's no guarantees, of course, because some things are out of your control, but what can you do nutrition-wise to decrease your risk? So yes, there is a whole research database of good practices nutrition-wise that can help reduce recurrence.
That's also great that there's a lot of information out there about the impact of nutrition, right? So it's not kind of like we're grasping in the dark. We're saying, don't eat this, don't eat that. There's the evidence-based research that shows that, a particular diet or a particular, I guess, trend of foods can be more beneficial than others for people. And I think that's important, particularly in today's world with so many fads about what you should be
Yes.
doing and what you
Yeah.
shouldn't be doing and how you should be eating or what you shouldn't be eating. Does the like recommendation for you as a dietitian nutritionist, does that change based on the type of treatment someone is having, like particular chemotherapies or radiation, things like that?
Yes, I consider every patient unique, both in terms of their diagnosis, their personal history, their diet history, the eating patterns they have. So there's that to start with. And then there's a difference if someone is having surgery, if they have a tumor that needs resecting on part of their GI tract, or if they have pancreatic cancer and they have a Whipple procedure, or if they have ovarian cancer and it's progressed and they're dealing with small bowel or head and neck cancer patients that have to go through chemotherapy and radiation, right to the main area where food is ingested and swallowed, those side effects are pretty severe. So there is a lot of difference based on the type of cancer and the type of treatment as to what people need and what side effects they're most likely to have.
That's great. And obviously, that individual approach probably also just adds to their level of, I guess, feeling supported and cared about as far as treatment goes. So, doing what we all do to see them as individuals, not just as their cancers or procedures.
Yes. I think that as a clinician, one of my top values is being able to listen and to be present to patients. to be aware of not only their nutrition needs, but their needs as a whole person, because all of that works together in synergy to help support them during treatment and improve their quality of life.
Wonderful. So, what do you find to be the most challenging part of working in healthcare as a dietitian nutritionist?
For me personally, it's managing compassion fatigue and avoiding burnout, because oncology, there is a lot of suffering, there's a lot of challenges. And so for me, it's learning the tools to stay grounded and take care of myself and be able to process all that so that I can be the best clinician to my patients that I'm capable of.
Thank you for saying that. I don't think enough people honor that is a significant challenge in the work that we do. But of course, honoring it allows you to get up every day and do it again.
Yeah.
So, what do you find to be the most rewarding part about working in healthcare?
One of the most rewarding for me is I enjoy the clinical complexities and the social emotional complexities of my patients. And I think having a skill of being able to work with that and identify that serves patients well. So when I get patients that thank me or their nutrition improves and they're able to maintain their strength, that feels very rewarding.
And also, your work is so, when we talk about work being holistic, it really feels like you are embracing and understanding all that this person is and their relationship with food.
Yes, and I think that is important. And I think people intuitively know when people care for them and are
Mhm.
genuinely listening to them and, wanting to respect their self-autonomy and direction. People value that. They do value that very much.
In the work that you do, have any of your patients or either that they have worked with an oncology trained massage therapist or esthetician, or do you potentially refer them for services like body work and skincare?
We are very fortunate here at Dartmouth Cancer Center to have an oncology massage therapist that is with us in our infusion area, Lisa Harbis. She is a wonderful presence.
Mhm.
Her work among our patients, the support, both the emotional support and just the therapeutic touch, I have seen over and over again in so many situations. That brings goodness to our patients. It helps them, it helps their nervous systems be at rest, because getting a cancer diagnosis and coming for treatment is very anxiety provoking. And so people respond very well to having that service available. So I've gotten to witness firsthand the work that oncology massage therapists do, and it is remarkable the way that it supports the whole person, the way that it supports my work, because when a person can have their nervous system reset and can be calm and can integrate, whether it's massage therapy and other therapies, it helps their nutrition, because nutrition isn't an island. It's interconnected to the work that you do, and it's interconnected with the work that all the other members of the healthcare team do.
It's wonderful. So, in terms of the healthcare team, how can we all be better at collaborating with other professionals who support cancer patients?
I love that question, and I love collaborating because I love my team here. I share my office with social workers. I am always talking about encouraging my patients to receive massage therapy. So I love collaboration. So I think, Erica, what you're doing here on the podcast by giving visibility to this need, I think that is huge. And then I always go back to listening to my patients. when I'm getting their history, what are they telling me? Do they have, significant socioeconomic needs? Do they need to see our social worker, our resource specialist? Are they open to integrative and complementary therapies in addition to the massage therapy that's offered them? Because our hospital does have a complementary care program. Do they need a palliative care provider? So for me, it's listening to the patient and making them aware of, hey, I see you have this other need, that's out of my scope of practice. These are where you can get connected to those resources. Would you like to be connected to them? So looking at the patient as a whole person with many different needs, physical, emotional, social, spiritual, financial, is just one piece of the puzzle, and it doesn't exist on an island. So that is where I start.
That's amazing because it also, as you were talking, I just automatically thought, right, socioeconomic status, direct correlation to the quality of nutrition that people have access to. And
Yes,
therefore, for someone also dealing with a cancer diagnosis, could be a significant stressor. And
absolutely.
obviously, you want your intervention to be as positive as possible. So, not only identifying for them the best way to manage their nutrition, but also even the basics of access.
Yes, access screening for food insecurity. And if that's present, helping them to get connected to resources that can help them, either ones that I know of, food pantries that allow for client choice, which is very important for patients during cancer treatment that are dealing with side effects, that food pantries allow them to come and choose the foods that they're able to eat,
Yeah.
or working with the social worker and making sure that they have access to all the government programs available to them, which sometimes people didn't know they could access, or they don't know how to access them. So
Right. Or may have been fearful
yes,
about what that actually means or if accessing would be something that was available to them.
yeah,
Amazing. Thank you
yes.
so much, Beth. This has been wonderful. I know I have learned a lot, and I truly believe our listeners, their eyes opened about the benefits of a nutritional specialist. And I think the work that you're doing is wonderful. So thank you, thank you, thank you.
Thank you, Erica. I am glad that we could collaborate together to improve the support and care to all cancer patients. Thank you.
Thank you. All right, collaborators, have a wonderful day, and I hope you enjoyed today's podcast.